There are many options available to replacing missing teeth. One could be to just replace that single missing tooth by using an implant. If the tooth has been extracted for many years, that area is most likely healed and implant can be placed immediately. Sometimes if there are infections due to teeth that are broken or have been root canaled, then there is a little bit of time to let that area heal up before an implant can be placed. The best way to find out if a mini implant or a traditional type of implant can be used on you is for you to come in so I can do a free consult and a scan, and I can go over all the options that are available to you so you can make an informed decision.